Welcome to Doctors at Work. My name's Matt Daniel, and this podcast is part of my mission to help doctors create successful and meaningful careers. Today's topic is about bringing well-being and lifestyle medicine to patients and to doctors. And I'm having a discussion with Sui Wong, who's a neurologist with a somewhat creative career pathway. She took time out of training to do charity work. She's a trained yoga teacher. She studied lifestyle medicine and she wrote books. In this episode of Doctors at Work, she talks about her own career decision making and tells me how she developed innovative ways to deliver clinical care using her knowledge of lifestyle medicine. We focus on well-being for doctors and we talk about the mind-body connection and the importance of healthy eating and exercise. Welcome, Sui. Tell me a little bit about yourself.
Thank you so much, Matt. Very privileged and glad to be here. So I'm a neurologist. I work on the NHS, and it's been a few years now that I've been a consultant on the NHS. I started out being trained in internal medicine, as we do in the UK, getting my MRCP, and then I traveled. I left the NHS for 2 years, went to do volunteer work for a year, and also worked in Australia, came back after 2 years, back to the conventional. It was quite hard, but got back into training, into neurology, and then finished my training as a registrar, became a consultant, but decided to do something different, to do to do a fellowship in neuro-ophthalmology. At that time when I did it, I was one of the last Kelman trainees, if you remember Kelman, of course. And it was really unusual to do a post-CCT training in neurology back then. So I did that. And then now I've been working as a consultant in neurology and neuro-ophthalmology.
And you had an amazingly varied career, and also you've also written books, and you've also developed some quite new innovative ways of working. And I'm going to come on to the book and the innovative way of working, but I'm interested a little bit in your career decision making, yeah, because you haven't had a kind of a standard conveyor belt career path. And I know that lots of people are interested in exploring careers that are not the kind of the standard conveyor belt. So if I think, when you took time out and you did a fellowship that was unusual, and then you're doing very unusual things now and writing book, how did you go from the conveyor belt to having sort of this really quite different career?
It was not planned at all. And basically, it first started with me realizing that, not realizing, so I got into medicine as a international trainee. So I came to the UK. It was really, really hard to get in based on the ratio of people who would be able to get in, the number of applicants. So I always felt very, very privileged, lucky rather, that my parents worked so hard, saved money to be able to send me over. So the first stage when I decided to take time out, it was actually me deciding I needed to do something to give back. And I wanted to do volunteer work. And it was just unusual for people to step out after getting the MRCP before going into the specialist training. But I thought I had to do it. So I decided to do it despite my seniors, other consultants saying, my mentors, etc., saying, "Oh, it's not a really good idea on your CV." But I thought I had to do it, and that changed a lot of the way I see things. Because as I was working abroad, as I was traveling after that, doing my volunteer work, it kind of opened my eyes to different ways of doing things. And when I came back to my first job interview for a registrar job, it went well because I had interesting perspectives and interesting to say things to say. And that made me realize that if I followed a path that had a good intention behind it, and I do it with purpose and authenticity, something fine will come out of it. It will be fine. And when I wanted to do the fellowship, it was also unusual. I loved being a loved doing neurology, I mean. I love the art of it, the science of it. And I wanted to learn more in terms of the neuro-ophthalmic side. I wanted to understand more about eye movements and various other visual side of neurology. And I thought, well, I have to do this. So it's all going by what I feel, oh, this would be really meaningful and purposeful. And making efforts not to be too worried about what will be next after that. It's
Yeah.
more of having that um, feeling that, okay, if I do this in an authentic way, something will happen at the end. It'll be
Yeah.
fine. Whatever happens, you'll be fine. And it has been, and it's been quite an adventure.
Yeah. It sounds interesting because the thing that I often talk about is the idea of career towards moves and away moves. Yeah. And one of the things that often happens, and I'm sure you see this as well, is that lots of people are struggling, and whether they might be struggling with their well-being, people struggle financially, people get separated and live far away from the
Mm,
family, and then they do moves that are away move, by which I mean is I want to go away from a place that's stressing me. I want to go away from a career that's separating me from my family. Yeah. So
mm,
they're not saying I want to go towards giving back, or I
mm,
want to go towards learning. I want to go away from something that is stressing me out. Yeah. So, and I
mm.
think what you've outlined there is what you've done is you've done towards moves. There's something
Yes.
that was really passionate and you move towards it. And I guess really in the worst case scenario, I mean, what's the worst thing that could have happened is you would have spent 2 years doing something that you loved. Yeah. That's the worst thing that would happen, isn't it?
Absolutely, absolutely. And it's a case of, I still get to be a doctor. I love being a doctor, and it's fine. It's just go and explore and not be too constrained by what others think, perhaps, which would be the kind of will I get the next job situation.
You sound very brave.
I'm not naturally brave, I don't think. I think it's a case of I just so happen to just do the next thing, which has helped me believe in myself, and do the next thing to believe in myself. And yeah.
But I think the reason why I say brave is because I think some people will say, "Oh, I worry what will other people think of me? I'm not going to get a job. What will I do for money? I'm going to struggle." And then they don't do it. And you've talked about an adventure. You just did it. That's what I mean. To me, it sounds like you're very brave in what you've done.
Oh, well, you're very kind. I feel like, although it sounds unusual, I suppose every step of the way, when I were to do my volunteer work, when I were to, do the fellowship, I will really immerse myself in it, and I did the best I could, and I really learned, and I tried to be of service, and I think that thread comes through, so that whatever happens with the next step, even if it's a slight sideway change, it's actually bringing across that consistency of going, oh, I'm doing my best. The reason I'm doing this, and kind of coming with the reasons of doing something. And yeah, I think that keeps um, the next steps open.
Yeah. Yeah. So how did you get into writing books?
Well, actually, that was because I wanted to bring lifestyle medicine into my clinical care. So what I did not share, as in you were talking about moving away, I was also very stressed.
Okay.
Because trying to get the MRCP exam, trying to juggle, it was the days before the European Working Time Directive, working many hours on calls, studying for exams, and I wasn't really taking care of myself, going for buying ready meals, and actually the hospital setup, that's a whole other thread, on calls, what can you get? Just something from the vending machine that's a chocolate bar or something like that. And I wasn't really taking care of myself. And as I was when I started starting my first consultant job, I realized that, oh, if I were to eat better, started doing yoga and eventually trained to be a yoga teacher, and that's a separate story. But basically, I started bringing in lifestyle approaches that really transformed how I felt internally and my well-being, and how I was able to be a better doctor. And I was living that life, and I was also promoting that amongst my family members. And that's when I realized that why am I not then doing the authentic thing of sharing that with my patients? And of course, as doctors, we always feel that we have to be certified and approved with everything. So I then did my diploma of lifestyle medicine. And as part of that, I was able to bring in lifestyle medicine into my clinics, delivering other innovative deliveries such as group clinics, group consultations. And it was with all those conversations and the kind of challenges that I find on a consistent basis that made me realize writing a book would be very helpful. And, people will be asking me like, oh, if it's so useful, why are you not talking more about it? Which is why well, I'm here now and also writing those books for those reasons.
Yeah. I'll come back onto how we as doctors look after ourselves. I'll come back onto that in a minute, but I'm interested in, you also said that you brought all of this into your clinical setting, yeah? Because, because I have an image, you're a neurologist, sort of you do fairly standard stuff. There's a standard way of working, there's a standard clinic with a standard number of patients. So I'm wondering, hold on a second, how did you go from all of that routine, well-trodden way of working into bringing lifestyle medicine into a neurology clinic?
Well, firstly, there has to be buy-in. And one of the ways I could get started with an innovative approach of building a group clinic was it was to do with waiting lists. There
Okay.
were so many number of patients waiting and number of patients already under my care. So it is for a condition called idiopathic intracranial hypertension, and it's a condition where there is raised pressure in the head related to excess body weight. So, and weight loss can cure the condition. So it's behavior change and lifestyle approach can be very effective. So I found that I was having the similar kind of conversations in one clinic, but the first person at 1:30 has got much more of my energy compared to the last person at 7 p.m. Well, it shouldn't be finishing at 7 p.m., but that's the way it was at that time because of so many patients. And I realized that if I were to bring them together in a group setting, then there could be a lot more value with a lot of peer-to-peer conversations. And when I started having this idea of whether I could do it in a group, that was around the time I started doing my diploma of lifestyle medicine.
Mhm.
And at the British Society of Lifestyle Medicine conference, there was a whole session on group consultations. So it was really fortuitous. I managed to speak with the various people as part of the British Society of Lifestyle Medicine, got and figured out that this can be done with a society behind this, and I then started to campaign. I had to lobby my firstly, I have to share the concept with my clinical lead, very supportive, and then I had to get my service manager to agree, which was much tougher because I had to raise some funds to get ourselves trained by Group Consultations Limited, which is a non-profit part of the BSLM. And so I had to raise 9,000. And I thought, oh, this is going to be really tough. So it was lobbying and then managed to get a bit of bursary. And then once we got that going and delivering it, doing it through a QUIP system, showing what the problem was, what's the outcome, the patient feedback, and that whole loop showing that patients love it. They find so much value with peer-to-peer support. The clinicians, myself and my colleagues, we just feel it's much more enjoyable, the whole session, because we're not just repeating ourselves and feeling at the end of it, oh, the clinic's really late and we're not really delivering care. We should, because at that time when with the old system, the 7 p.m. patient, I felt I wasn't really giving my best. I was just thirsty, hungry. It's the
Yeah.
end of the clinic. I'm tired and they would have been waiting for a while to see me.
Yeah.
So
Yeah.
all that made me go home and think, oh yeah, didn't really give my best here today. Um, and doing the group really changes the whole dynamics with patients and clinicians. So that is how it got started. And then in terms of the day-to-day consultations, is really not too difficult to bring it in. So, for example, if I were to talk about patients who have a autoimmune condition or migraines or such things, we can start off with talking about sleep. We can talk about, various other lifestyle bases. And now that I've got my diploma and I'm part of the British Society of Lifestyle Medicine, I can also bring in the evidence-based approaches to this.
Yeah. Yeah. And how did you get sort of these ideas to bring that in? Because lots of people, they turn up and they do the job and they don't see anything beyond that. But you clearly all the time you're looking outside, all the time you're thinking, what else is there? How can we do this differently? I mean, tell me a bit about your mindset that's always looking for different things and for new ways of doing stuff.
Yes, I guess I love being a doctor and I always feel like okay, I'm here to be of service and to improve my patient's outcome. And it was partly that, where I think, am I doing a good job today. I would go home and think, did I do a good job today? Or did I, the lifestyle discussions is part of, okay, I can talk about prescriptions of whatever migraine prophylaxis, for example, or prednisolone for whatever immune conditions. And then what are the side effects of prednisolone? Their metabolic health will be affected, their blood sugar goes up, weight gain, bone issues, and then what else can we do to counteract that? I can prescribe them, um, various things for bone protection, but what else? Lifestyle. And then what's the evidence basis for that? And actually, it's conversations with patients. And also, I'm very aware not to impose my concepts of healthy living. It's more about what the patient would find useful. And I was repeatedly encouraged by the fact that whenever I talk about other lifestyle approaches that they can have and prescription medications and this and that, people often want to do the lifestyle basis first. So for example, if I were about to start somebody on prednisolone for their treatment of their neurological condition, in that one of the consultation would be the pros and cons of steroids, the side effects, and then it seems that we will likely start on prednisolone. We all oftentimes need to prepare with doing a DEXA bone scan, what's the baseline bone density and such things. And that's at that stage I talk about it's a shared journey. I'm there to facilitate their care and we have to do this together. So then they really get really on board with their exercise, their eating, and various other lifestyle things that could protect their bones, prevent spikes in blood sugar or minimize it in any case. And yeah, that's what's been encouraging me, really the response and what patients seem to want.
Yeah, yeah. And you said that there was some challenges in terms of needing to raise money or persuading other people. So how did you go about raising the money? How did you persuade other people that this was a good idea?
Well, I think sometimes it's also understanding the way managers think.
Okay.
It's about so I understand that generally speaking, if we are on the NHS, we are there to deliver good quality care. But then sometimes we're also burnt out and we're constrained by finances and such things. So I try to think of what would be the manager's motivation, and that for them oftentimes it's about waiting lists, um, balancing of the books,
Yeah,
and ideally, if possible, if they are on board, and it depends on individuals, if it improves quality of care, that is also another motivator.
yeah,
So based on all that, I will put into that. I will couch the proposal in those words. At least I've got some figures, and thankfully, because of the group consultation support, I have a framework of how to calculate, how much it costs to see patients in one clinic, and does it mean with what happens if there is a DNA. So if a patient does not attend an appointment in the old system, that's a lost time.
yeah,
But
yeah,
if there was a group, if let's say we see 15 people, if one out of 15 does not attend, everything's still going ahead. There is no lost time. So
yeah,
it's those kind of approach, and also how we can then add in patients as on an urgent basis without overrunning. So if I have an urgent patient, I can just add into the group
yeah,
without really hugely impacting the time. So from 15, it could be 16, for example, and it will still be all right. It's not like I'm just staying on for another half an hour or another 45 minutes. And if I add two or three extra, then it's like, whoa, overrunning by 2 hours. So then it's not sustainable for the clinicians as well in terms of burnout and being exhausted.
I hope you're enjoying the show. Please click subscribe so you'll be notified when new episodes become available. This podcast is part of my mission to help doctors create successful and meaningful careers. You can be part of that mission too by forwarding this show to one person who you think might benefit from listening. Thank you. Now on with the show. Yeah. Let's move to clinicians then and clinician well-being, because you said that you recognised that your own well-being and your own eating wasn't great, and what I know that's a really common issue. So certainly I have those problems also. I mean, what can we as clinicians do to look after ourselves better?
Well, I think firstly acknowledging that we do a tough job. It's a tough job, and we have to be aware that if we don't take care of ourselves, it will likely lead to burnout. and how do we actually take care of ourselves. There is the internal, what we have in our control, and there is also the organizational. So
Mhm.
this is talking about internal, and I'm very aware that there are other organizational aspects. So the internal things could be things like how is our stress levels, and it's how we respond to stress. As in our medical training, we're oftentimes trained to deal with highly pressured situations, patients who are very ill. So we're trained in that. But then what may be less is how do we manage our self-care after that? Because how do we come back down to something something that's sustainable. So it'll be things such as movement. So I talked about how I started doing yoga, and then I then trained and became a yoga teacher, and that part of that journey helped me become aware of the connection between my body and my well-being. So that a very mind-body connection, how I can use breathing to settle my body. So how it can, and really when we bring it to scientific terms, it's relevant to the autonomic nervous system, the fight or flight versus the rest and relax, the sympathetic parasympathetic balance, and how we utilize that, because sometimes we really need our sympathetic to go. If we are in a resus situation in A&E or emergency room, people come through, we need to be up and sharp and just going. And then after that, hopefully a come down to be able to breathe and settle. So it's really the balance. So I think firstly that awareness, and then what other lifestyle practices. So,
Can I just, I'm interested in a bit more about that sort of this, you said that you understood your body and the mind-body connection. Can you, what is that and how do you understand it and how do you develop it?
so it's the concept of mindfulness with the body, where we are aware of what is happening at this moment with our reactions to whatever's happening. And it's also bringing that quality of softness and kindness to that. That let's say we are having a difficult patient encounter, we may feel the tension in our body, the stressful thing, and there's a way to just be with that, and then settling and releasing that sensations. So that could be using um, movement. So I talked about yoga, for example, but it's the concept of as we are moving, we are feeling the sensations of the body, and that helps us tune away and just get in tune with that stress response. And with that, then comes the decision of choice, whether it's a case of there's been a very stressful encounter. I just need to step out of my clinic room for a moment and just walk down the corridor or just walk outside and come in again. Just even those few moments would just allow the sense of, okay, I'm just going to acknowledge that that was really very stressful, have a few, have breathe and noting that, I suppose. And then in a more advanced way, it could be actually taking moments of long exhales to settle down again. So there is the ratio between the inhale and the exhale, and doubling the length of the exhale or longer exhale in proportion to the inhale is very helpful for the parasympathetic to be activated. So, for example, if you observe it takes about 3 or 4 counts to breathe in, then I would say hold for that same amount of breath for that length of time, and then breathing out for about 6 to 8 counts, and then holding it again for 3 to 4 counts and breathing in again. So it helps tune in with, okay, I'm just breathing at the moment, I'm just with the body, and also that breath pattern can really help reduce the sympathetic activation.
So this is something that one can do in the moment or something that one does prophylactically to try and prevent getting really stressed or a mixture of both?
I think it's a mixture of both. So if say somebody is not really familiar with this, to be able to practice it on a regular basis just helps one get more in tune with that, to then be able to uh, settle and be grounded in a really activated moment. And then really bringing in all these extra practices just immediately after a very stressful moment, for example.
Because when you're actually in the stressful situation, it's for a lot of people, it's very difficult not to react. Yeah, something happens and people are very, very quick to react. People are very quick to judge. Yeah, certainly I am. And it's very difficult to kind of to stop yourself and to take that time out. So, I mean, what tips do you have for getting better at being able to consciously make decisions in the moment rather than just being on autopilot?
Well, I suppose the first thing is to be aware of that. So when somebody has awareness that, oh, they may be reacting in a way that they don't wish to react, um, then it's a case of reflection and also understanding of what happened in that scenario that caused one to react so quickly. And then making a decision the next time, do they want to respond in that way or not? And that is the first step, I think. And of course, I'm not a psychologist. I have to be aware of my limits here. It's about we sometimes find benefits to talking with people who are trained to help us think about our thought processes and thinking patterns. So there is the bigger picture. But otherwise, I think the moment to moment practices of being mindful really helps so that then it creates the space. I love this quotation from um, uh, Dr. Viktor Frankl, and I will paraphrase this, it won't do it justice, but it's along the lines of between stimulus and response, there is a space. And in that space is where we have the power to make a choice. And in that choice, is where we have our growth. So having these mindful practices, being aware of, oh, at this moment, I'm really very angry. What do I want to say next? And then do I step out? Do I say something that's helpful to create a pause? And that's where these opportunities happen.
I wonder how that applies also to to rubbish eating, because if I think sort of for my I don't know if this will resonate with you, but if I think when I was a trainee, I was a lot heavier than I am now, and one of the reasons was that I was always busy, I didn't have lunch, and then I was hungry, and then I was hungry and I was busy, and then there'd be chocolate, and and I'd eat chocolate, and on the way home I'd stop at the petrol station and I'd kind of buy more rubbishy food, and it was that all the time. I was so busy and I ended up not eating well, and that happens very much less to me now because I'm much more conscious of that. But even so, I'm still conscious when I'm busy. If I'm stressed, for me inevitably, I end up eating rubbish. So what's the relationship between our careers and busyness and stress and eating?
I definitely resonate with what you just said because I've experienced that as well. And also on some days when I'm really very stressed, I observe what I would grab for
Yeah,
a sugary hit. And that is firstly to understand that is quite a human response. And that's fine. It's a human response. And then does it serve us does it serve us in the longer term? And that's when you talked about how you used to be heavier and it sounds like you made a choice that didn't serve you.
yeah,
And oftentimes for me too, I found that if I were to grab a sugary treat, I find that I get a temporary relief, but then I get a sugar crash, or I feel really bad because actually my body is not feeling good with the kind of foods that we're eating. And so, firstly, that again, everything starts with the awareness, and then kind of realizing that maybe there are certain situations where it's really likely to need a release, and what other opportunities for alternative release apart from grabbing sugary treats or junk food. And of course, we have to be very aware that junk foods and sugars are also designed to be hyper palatable, and therefore it also creates a craving pathway that we tend to go for it. Gives that temporary sense of reward or that sense of oh, this is nice thing, and then it kind of creates a cycle.
yeah.
So I think sometimes we have to be aware that there is a biological reason why we continue to crave for these things, and also to take a kind approach to going, it's okay if I want to have it, and do I really want to continue to have it in this way, and what are the alternatives?
And what's the relationship between what we eat and exercise? What's the relationship between our lifestyle and our well-being?
Um, what we eat and we exercise. Well, exercise definitely can be a big a stress reliever. And if I talk about the whole um, neuroscience of it, there are also changes that can happen with the brain, whether it's a case of improving our cognitive function or releasing some of the endorphins, lots of benefits to that. And the metabolic impact of regular exercise would mean that we tend to stabilize our blood sugar more, and there is less of an up and down of our blood sugar roller coaster, which means more stability with emotional responses, with resilience and well-being. So stress response and well-being.
Yeah. So if I think let's bring it back to tips for doctors then, let's kind of say that there's somebody who's in their, late 20s, they're sort of they're in whether it's a F1, F2 or they're in core training, and that's a really, really busy and really, really stressful time because not only do you have a really stressful career, you've also got to be working your portfolio and you've also got to be
Mm,
in your career progression and you've also got to get on the mortgage ladder and maybe you've also got young children. So that I think that kind of late 20s 30s, I think that's a really really tricky time for us healthcare professionals. So what kind of well-being advice would you give to a 30-year-old?
yeah, I think that would depend on individual too, because of so many, as you say, lots of challenges. Um, and um, and I suppose a few things that would be helpful would be things like what a reflection every day of, oh, what went well today.
Yeah.
Because, the fact that somebody's doing that, they're training and, delivering the care as part of their training, it's amazing in the things that their impact can have on the person in front of them, their patient. So acknowledging their own efforts and how much they are, what a difference that they're making. It may be small, perceptually, but actually it is a really important contribution. So I think reflections of that, or what went well with certain interactions, whether it's with colleagues or patients or with their family. So having those acknowledgements of day to day, I think is really very important. And then there's all the other so-called health related things that will help stabilize uh, emotional improve emotional resilience and well-being. So then it comes to, oh, what kind of foods are we eating? How much alcohol are we drinking? How much caffeine are we grabbing every day? And what's the impact of all that? So for some people, it may be observing that, oh, actually, the amount of caffeine I'm drinking is getting me out of bed and going, and it is also affecting my sleep. And it's also making me feel more anxious. And therefore, let me see what happens if I cut down so that I only have 2 cups in the morning rather than 5 cups throughout the day, for example. So little things of what could be helpful with just the day-to-day. And for example, going, okay, physical activity. I know it can be very helpful. How often do I make time to go for a run or a walk? It may be very difficult with juggling family and career. So what else can I do? Perhaps on the way to the dropping the kids off the nursery, we'll go for a walk, so that it becomes a walk rather than various things like that.
Yeah, yeah. That the coffee made me laugh because I quite like an espresso, and then I realized that I was drinking espresso at work, and then I'd have headache all weekend because I wasn't
Yes,
drinking espresso at home, and it was I got into the habit of having espresso with one of my colleagues first thing in the morning, which was very nice and sociable, and then I realized that every weekend I had a terrible headache and
yes.
felt awful. And then I stopped drinking the espresso at work, and then my weekend headache went also.
Amazing.
Yeah, okay. So I've told you. So I'm 51, and and I've told you that I used to be overweight, and sort of, and eating sometimes still a struggle, and often I'm stressed, and the sort of the stuff that upsets me, and I'm busy. So what kind of well-being tips would you have for somebody like me?
Well, I suppose the first thing to say, are you happy with the current situation? Because it's okay for some people. They like to live a life in a certain way that's more of a on the go, and that's fine, you know? So if somebody like you say, oh, I'm feeling more stressed than I wish to be, then it could be a case of what's the balance of doing how much you enjoy
Yeah.
and how much you don't enjoy. And I suppose it's a bit like what you were saying about moving away, moving towards, but finding that kind of balance.
Yeah.
And about what other things are you doing for enjoyment? And are those enjoyment activities beneficial for your well-being? So it may be enjoyment with drinking, but does that lead to binge drinking? And does that then affect health in a negative way? Um, or is it something like going on hikes? Because actually connecting with my friend or family as we go on a hike whilst doing this physical activity and being kind of bringing in mindful moments of enjoying nature, observing what's there, the temperature, whether it's rain or sun, that sort of thing. So the day to day. And I would say bringing in something small every day that could be part of a routine of self-care. So that could be doing a stretching routine every night before going to bed,
Okay.
kind of coming down with breathing and feeling the sensation of the body as you're stretching. And that could be 2 or 3 minutes. And then that helps the winding down to then create a routine for more restful sleep, for example. Or it could be, say somebody said, oh, I actually want to eat better because I usually grab for the pasty or sandwich because I don't really have time and don't have a choice. And then it's going with, oh, what do you tend to have for dinner? And could you cook double that amount and then take it to work the next day? And what's the balance of the food that you're having? Could you bring in more greens that will then stabilize the blood sugar and give you the nutrients that your body will benefit from, for example?
A lot of this sounds about conscious decision making, yeah, because sort of instead of being an autopilot and just do whatever is easy, whatever comes up, whatever your brain tells you sort of to do or whatever your emotions tell you to do, it kind of very much sounds like it's about consciously thinking what you're doing, analyzing what you're doing, and conscious decision making.
Yeah, and sometimes it doesn't have to be a very in-depth analysis. Sometimes it's just being aware at that moment, going, oh, actually, I don't feel so good right now. What is helpful next? That sort of thing.
Yeah, perfect. Thank you very much, Sweet.
Thank you so much, Matt. Really appreciate being here.
Thank you.